Welcome to the third episode of Brain Attack series. So in the last two videos you've seen about what is stroke, the types of stroke, what are the causes and prevention methods for stroke. So today we're going to be talking about the different signs and symptoms that you will be able to spot when somebody is having a stroke so that you can be fast. So before I go into what is Be Fast, I want to take you through two scenarios that has happened, and then we can see what exactly this Be Fast means. So in the first story, this guy, he identified that he is having some of the symptoms of a stroke, and without wasting time he immediately went to a hospital which was equipped for treating a neurological patient, for treating a stroke patient, which had scans with them and a doctor, neurosurgeon, neurologist with them. And he went there immediately, he had his scans done and immediately came to know that it was a stroke. And since he was able to reach the hospital within the window period, which is the most important time, because he took the intervention immediately, the interventions that is done for somebody with a stroke is going to be explained in detail in the upcoming videos. So this person has taken these emergency medical interventions, he underwent the treatment, and then he came out with a very good progress. He was able to go back home walking, he did not have much deficits, and he was functionally better, and he made it back to how he was before. Now the second scenario, there was a patient, he had some of these symptoms, they waited a day saying that okay, it may be something else, so they missed out on the most important time, the window period, and they did not seek any immediate medical interventions. When he started getting worse, the family took them to a hospital which was not equipped for handling stroke patients, so then they had to go somewhere else, then they went somewhere else for a scan, and they basically did what we call here as the Bangalore Darshan, where they had to go to multiple places, and then they finally came to us. By then it was too late, he was out of the window period, we did whatever we could, and after that the recovery that happened and the time it took for them to come back to whatever function they were having before was much longer, and the problems he faced were much more severe than what happened in the first story. Here if you see, there are three main things that happened that makes these two stories very different. First is that in the first story he knew what were the symptoms, he knew how to pick it up immediately, but in the second case they were not aware that what could be causing a stroke or how to pick up a stroke when it is happening, what are the signs, what are the symptoms. Second thing, they knew where to go. Immediately they knew, okay, I shouldn't waste my time going to this place, I should go to a fully equipped hospital. And third is the time they took. Because the first person was very fast, it made sure that he received the necessary treatments as fast as possible without letting the brain get more damaged, because the more you wait, the brain gets damaged that much more. So here we say something called as time is brain, brain is time. So that's how important it is, because every second you waste, that much more neurons are getting damaged. Now that I've taken you through both the scenarios or the stories, I'll now take you through what are these signs and symptoms that you have to look out for. So globally what is used is something called as the Be Fast acronym. It was recently changed to Be Fast. Initially it was just Fast. Now what we use in the last few years is something called as Be Fast. So what exactly is this Be Fast? So it stands for B is balance. So you sort of lose balance, you're not able to stand up straight, you may have a risk of falling down, and all these kinds of things that affect your balance is basically what you look in B. Second is E. E stands for eyes. So there will be an asymmetry of the eyes, one side may be closed, there can be some double vision, some blurriness, some kind of darkness that may come. So the next thing is F. F stands for face. So face, basically you can have a asymmetrical drooping, one side of the lips may come down, there may be weakness on one side of the face, numbness on one side of the face, some weird tingling sensations on the face, which is also an indicator of somebody having a stroke. Next is A, that is arms. So basically you lift up your hands and you will be, one side may go down, you may not have the strength to keep it up. There may be weakness in one side of the hand. So that is another thing that you can look out for. Next is S, which is speech. So here you can either have no speech, that is the person may stop talking completely, they may talk in a confused state, or they may speak in a slurred speech, that is it will not be cleared like a person who is drunk when they speak, how it will be, that's how the quality of speech may be. And the last one, T, it's very important, that is time. Make sure you act fast, you take immediate steps, you make sure that the person who needs the help, or if it's yourself, you reach the hospital on time. Just a quick pointer on what kind of hospitals. Make sure there is a neurosciences department in the hospital, and also make sure that there is a MRI CT scan facility available in the hospital that you go to. Just a quick summary of what we have gone through. Be fast. Balance, eyes, face, arms, speech and time. So make sure that you are fast enough to help yourself or somebody that you love, and make sure to send this video to people who you love, to make sure that there is enough awareness, and so that people can make the right decisions at the most critical time in their life. So before ending the video, I also want to just add, like I am a speech language pathologist, but along with that I also take care of the digitalization part of the company, and I want to tell you that we are doing this particular project of the Brain Attack series to make sure that there is awareness and people are able to get the right kind of help that they need, and we wanted to make a go-to place or a one place guide for all questions you have related to stroke. So stay tuned and subscribe our channel to make sure that you don't miss out on any of the upcoming videos. Thank you.